Hi, James.
Hey.
How's it going?
It's going great. How about you?
I'm doing well. Thank you for asking. Welcome to the office. It's
Thank you.
nice to see you today.
Thank you.
So I have you down for a detailed and kind of up-close skin exam. Is that correct?
That is correct.
Okay.
Yes.
All right. So can I have you just confirm your name for me?
Sure. James Monroe, Monroe.
Okay, perfect. And is it okay if I call you James, or do you prefer Mr. Monroe?
James is fine.
Okay, perfect. All right, and then can you just confirm your date of birth, please?
Sure. 2/17/1990.
Okay, thank you so much. Okay, so it looks like so far your preliminary diagnosis is some kind of facial tingling and numbness.
Yes.
Okay, and is that kind of coming and going, or has that been consistent?
It does come and go, but it's been more consistent as of late.
Okay. And I saw that that's kind of happening on your scalp as well.
That is correct, yes.
Okay, well, just to kind of explain a little bit of what we are going to do today, I have my tools here set up to perform a series of skin examinations on your face and scalp.
Okay.
So I'm going to be testing multiple different things, testing for any skin conditions or abnormalities, checking the elasticity and hydration of your skin as well as the texture. I'll also be doing a series of in-depth sensation tests via stimulation of the skin.
Okay.
So that will be stimuli that include soft, sharp, dull, cold, warm, and pressure, possibly some vibration. Essentially, this is to kind of obtain a baseline skin condition and overall health of your skin.
Okay.
We want to rule out any kind of neurological dysfunction that could possibly be causing the tingling or numbness in your face, okay? So I do have some things that'll kind of specifically pinpoint any signs of sensation loss, any signs of possible neuropathy that could be causing the tingling specifically. So this will definitely help us rule out any of those neurological abnormalities. Okay. So let's go ahead and get started. You will hear me typing throughout the exam, and I will just be taking notes to make sure that we document everything accordingly, okay?
All right.
Okay, so let me just set this down. And are you comfortable in the position that you're currently lying in?
Yes, I am.
Okay. So I'm going to go ahead and put on a pair of gloves so I can start with my initial examination. And that will just consist of me having kind of a visual external look at your face and scalp. Okay, so I have a pen light here, so you might want to close your eyes just because it is a little bright, but I will be shining this over your face. And just to start, like I said, I'm just getting kind of an initial idea of what might be going on, checking for anything external that might be causing these symptoms. And have you noticed, like, does this happen at a certain time of day, or if you're more tired, or when you first wake up? Is there any specific instance that you notice around when you feel either of these symptoms?
Probably more so later at night, and if I'm tired as well.
Okay. So overall, the natural state of your skin appears to be fairly healthy. Not noticing any signs of acute dehydration. You appear to be well hydrated. Do you drink water regularly?
Yes, I do.
Okay. So texture is smooth and not overly dry. It's also not overly moist. You don't appear to be perspiring at this time. I see a normal pattern in hair growth along your beard line, and your lips appear to be well nourished, healthy, hydrated. I don't notice any flaking or any signs of abnormal discoloration. You do have Maybe one or two moles. You have one here on your nose, but it does appear to be normal in color and size for the area. It's slightly raised, but it does appear to be fairly symmetrical, so I'm not worried there. Nose is slightly congested, but nothing to be concerned about. It's more so cosmetic. If there were something you want to do about kind of tiny blackheads and sebaceous filaments, but it's nothing that will cause me to worry. You have a very small mole on your forehead here that I will measure later. Okay. Overall appearance of your hair, it's very thick. Appears to be clean and well hydrated. I'm not seeing any acutely obvious signs of dandruff or flaking. Do you have dandruff?
No, not excessive.
Okay. So I will be having a closer look at your scalp, but just from an initial perspective, I'm really not seeing anything externally that would indicate any cause for concern.
Okay.
So it's more likely that these symptoms are caused by some sort of neurological dysfunction, which hopefully we can come to the bottom of today. So I am just going to have a quick look at your ear. Any issues with your ears or your hearing?
No.
And since these symptoms started, you haven't noticed any loss of taste, smell, anything like that? Your senses are not lacking in any way?
No, they're not. They're not.
All right, well, let's go ahead and move on. I do want to start, I think, with a closer look at your scalp. So I have a couple different combs here. You will feel me just kind of moving around through your scalp and your hair. If at any point I pull your hair or it becomes uncomfortable, please just let me know, okay?
Okay.
Okay, so I'm going to have a closer look at your hair here. Specifically looking at the hairline where there tends to be more obvious signs of abnormality, but so far everything looks okay. So overall integrity of the hair appears to be within normal limits. I'm not getting any excess shedding or breakage at the follicle. I'm also not noting any signs of abnormal hair loss. Growth pattern appears normal. So I'm just going to separate a small section at the base of your scalp here, and I just want to have a look. Any pain or discomfort as I kind of tug on your hair?
No, there's no pain. You have very thick, healthy hair, especially around this temple area. We tend to see thinning, but it's pretty even throughout, which is a sign of good scalp health. Can you tell me how frequently you wash your hair?
Every other day or so.
Okay.
At least 3 times a week.
And do you use a shampoo and follow up with a conditioner?
Yes, I do.
Do you wash your beard just as frequently?
I wash my beard maybe more frequently.
More frequently.
Yeah.
Hair's very long, appears to be in a healthy state. I'm really not seeing any signs of flaking or any sort of folliculitis, which would indicate an infection in the hair follicle itself. Your hair shaft appears healthy. You don't have any split ends really, which I wouldn't expect because I'm guessing you're not using any hot tools, but there's also no product buildup. Your scalp is very clean. It's not overly dry. And it's not discolored in any way. Your pigmentation is in line with your age and ethnicity, so there's no concern there. You don't appear to have any burning of the scalp, which can come from overexposure of the sun or any other UV rays, which is good. Integrity of the hair overall is very strong. Even with excessive manipulation, I'm not seeing any shedding. Do you brush through your hair at least once a week?
Yes, I do.
Okay. That is important to keep up with as it helps get rid of any hair that's shed. Tighter curl patterns such as yours sometimes have a hard time expelling excess shed hair, so it is important to brush your hair out at least once a week, I would say, just to help get all that hair that's already been shed untangled from your otherwise intact hair. I'm just going to make a quick notation here. Hair appears to be intact. Follicle is healthy. No signs or symptoms of scalp abnormalities upon visual inspection. Okay. So we do have another comb here. This is just going to help me get a little more of an in-depth look. This is a finer tooth comb. How frequently do you have your hair cut?
Every few months.
Not too often, which is okay. There's a small line of demarcation here where your sideburn meets your beard line, which is what we would expect to see. You do not, however, have any hair loss in this area. Some people have the issue where they attempt to grow a beard, the beard does not connect with their hair, and yours does. Just indicates healthy growth. Your beard hair overall is much coarser than the hair on your head, which is totally normal. It's a different texture hair, which is what we usually see. Do you ever have any issues with your beard, such as itchiness or dryness, flaking, anything that would indicate any sort of dermatitis in this area?
No, nothing at all.
Okay. So that can be common. Some men have trouble keeping this area of their face clean underneath the hair. They're not washing it properly, but it seems like you have a decent hygiene routine, so I don't think that's anything that we need to worry about. I'm not seeing any signs of a fungal infection, any signs of folliculitis, there's no thinning. Do you ever experience ingrown hairs in your beard, specifically kind of underneath in this area?
It depends. If I cut it too short, when it grows back in, that may happen, but I normally keep it longer, so I don't have that issue.
And that is common when you shave any area of the body, especially an area that's high friction. When the hair attempts to grow and push through the skin, it can cause ingrown hairs, so it is ideal that you keep yours trimmed and not fully shaven to kind of avoid that. Kind of down here. I do see one gray hair.
Yes, that's the only one I have.
The only one. You're keeping track. That's good. Very good. Your beard is not tangled at all. I am able to comb through it freely, which is great. A sign of good hygiene. Hair is very long. I'm going to have a look at your eyebrows. And I'll just be using the same comb. Kind of brushing in either direction. Checking for any signs of infestation. I have seen some cases of mites in eyelashes and eyebrows, which we obviously want to treat immediately, but I'm not seeing that here. Do see some slight flaking in this area, kind of at the front of your eyebrows. Indicates a little bit of dryness of the skin and not so much an issue with the hair itself. Do you ever groom this area or just kind of let it hang out in its natural state?
Just let it do its own thing.
Okay. I'm going to have you keep your eyes closed tight for me. I'm going to have a look at your eyelashes here with my pen line. Eyelashes are very thick and voluminous, long. I'm not seeing any signs of breakage or abnormal hair pattern. I do notice some slight tearing in the corner of this eye, the inner tear duct here, not so much on this side. Do you tend to experience excessive tearness on this side?
Yes, I do.
Okay. Okay. So I have just a little clip and it's going to help me section off just a small area of your hair. Perfect. Okay. I want to test some sensation briefly. So just as an example, can you feel this?
Yes, I can.
Okay. And can you feel this?
Yes.
Feel this here?
Yes.
Does it feel pretty soft?
Yes.
Soft here. So can you tell me if you feel 1 or 2 points?
I think just one.
Okay. Just 1 here?
Yes.
1 here?
2.
Very good. Okay. And this should feel soft throughout.
Yes.
Good. Can you feel this here?
Yes, I can.
Does this feel different than the soft?
Yes, it does. More pointy.
Okay, very good. And how many points do you feel here?
1.
Here,
2.
here,
2.
and here?
1.
Very good. Okay, just using the pointy end of this to manipulate the skin. Okay. Can you tell me if you feel a difference between these 2 points?
No, I don't think so, no.
No? Does it feel the same to you?
Slightly different.
But here it feels the same?
Yeah.
Okay. So I'm noting a slight abnormality there. You feel this?
Yes, I can.
Feel it all along your hairline.
Yes.
So I'm going to trace your hairline, and I want you to tell me if at any point it feels any less sharp. So that all feel the same
For the most part, towards the end, I guess it felt a little less sharp.
here.
Yes.
Interesting. So can you tell me if this is less sharp than this?
No, it's the same.
About the same. And if we do this and this compared to this area here,
I believe the top is more sensitive.
okay, so more so feel the sharpness here.
Yes.
And what about on the sides? The same?
It's the same.
A little bit of loss in sensation here in the temple area. we do this, can you feel that?
Yes, I can.
Does that feel sharp?
Yes.
All through your scalp. Does that feel any less sharp?
No, about the same.
About the same. We go different direction. Does that feel about the same?
Yes, it feels the same.
Now if I go down, does that feel any less sharp?
No, it doesn't.
Do these areas feel more sharp than here?
Yes.
Okay, on both sides. So here compared to here.
Yes.
Okay. And what about here? About the same as here?
Yes. More sharp there.
More sharp here?
No, the second.
Here.
Yes.
Okay. So more sharp here, but not more sharp here.
Correct.
Okay. Interesting. Okay. Can you feel this?
Yes, I can.
And here and here?
Yes.
Does that feel kind of cold?
No, it doesn't.
Doesn't feel cold. Does it feel cold here?
No, it doesn't.
No. Here?
No. No. No.
Okay. So there's some mild temperature loss there. And does this feel sharp here?
Yes.
Okay. Let's see. Can you feel this?
Yes, I can. Yes. 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 Yes.
Okay, and here.
Yes. 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 Yes.
So any difference between this and this
No.
and this and this?
No difference.
So this feels the same as this.
Yes, it does.
Okay. It's very interesting. So with this texture, it does feel the same sensitivity as here, but with the sharper tool, it was a little more here. So that's
correct.
something to know. And then if we do your eyebrows versus here, that feels the same.
Yes, it does.
Okay. And the same here as well.
Mm-hmm.
Okay. Can you feel this?
Yes.
And does this feel different than this?
No, it doesn't.
This and this feel the same?
Yes.
Okay. So here and here, that feels the same?
No, it feels different.
That feels different. Here and here,
Slightly different.
slightly different.
Slightly.
Slightly more obvious here.
Yes.
Okay. And what about on this side?
Just slightly still.
Slightly. And if we do down here,
Yeah, it's different.
it's a more obvious difference.
Yes, it is.
Not so obvious here.
Right.
Interesting. Okay. And how about in this area? This and this?
Slightly.
About the same as here,
Mhm.
but less than here.
Yes.
Did note an abnormality there. And it again is in that kind of temporal region. A little bit of, I would more so say a lack than a loss of sensation because you can feel it. It's just not quite as prominent as here. Okay. So this one you might not be able to feel because it is kind of difficult. Can you feel this at all? Puff of air?
Not really.
Not really. Do you feel that anywhere on your face?
Yes, just at my nose.
You felt it here?
Yes.
Do you feel it here?
Yes, I can.
Can you tell me where it is now?
My nose. cheek, other cheek, forehead, eye, other eye. Tell that last one. Chin, eye, eyebrow, eyebrow.
Okay, so you can feel it. Does this feel less than this?
Yes, actually.
Okay. And this is less than this?
Yes.
But this and this are the same?
Yes, they are.
Okay. Alright. Here and here, same?
Yes.
Okay. So again, temporal abnormality. This time it was the ear. But you were able to feel it, just not as much. So we're not seeing total numbness. There's not like a complete lack of sensation. It's just you're feeling a little bit of kind of not as much. So let's try to level this. If we were to say that this is a 10 out of 10, meaning you can feel it the most that you could possibly feel something, versus this, what would you say?
8.
This here is an 8.
Yes.
And this here is definitely a 10. You feel that completely.
Yes.
Okay. And this side?
Same. 7, 8.
7, 8 on this side, 8 on this side?
Yes.
Okay. So if I kind of map out an area here, do you feel this?
Yes, I can.
Can you tell me when you start to feel it 10 out of 10?
Right there.
Okay. On this side.
Right there.
Okay. So this side is slightly less actually than this area, but you did start to feel it kind of midline forehead, which is interesting. Okay. Can you feel any difference between this pressure versus this?
No.
No, this feels the same.
Yes.
Feel the same here?
Feels less intense.
Which one? So let's say this is 2. This is 1.
Still 2.
So 1, 2.
Yes.
So I'm wondering, you do have some slight texture in this area, which is where we're getting majority of that sensation loss. I'm wondering if that has more so to do with the texture difference, or if that truly is a neurological abnormality, because it does not appear that it kind of goes up into your hair area. Because if we know that this feels less, but this does not, correct?
Correct.
So this feels the same here.
No, it's more sensitive on my forehead.
More sensitive here still. So you do
Yes.
still have some slight loss in feeling here, but not as much as here.
That's correct.
Okay. And if I separate your hair so that we are just getting your scalp, tell me if it starts to feel any different or if it feels the same all the way.
Feels the same until the very end.
And what does it feel like at the very end?
It feels less intense.
Okay, so that's where your hair is. Okay. It feels the same up until here.
Yes.
Okay. And this area feels the same here.
A little, yeah, about there.
Okay. Okay. Just using this tool to kind of pinch certain areas. And this helps to momentarily restrict blood flow so I can see how quickly the flow returns. It also tests your skin elasticity and your overall turgor of the skin, which helps me see if this is more so an internal causation, which would be more likely a neurological abnormality, or if this is something more physical. There doesn't really appear to be anything outwardly abnormal, which is my concern. Because if I were seeing kind of a lack or a decrease in skin elasticity, then that could explain why you're having that decrease in sensation, but your skin appears to be fairly healthy. I'm not noting any excess signs of dehydration or anything that would appear to be a loss in blood flow. Could be something further down that we're just not seeing. This all appears to be normal. I'm not noting any abnormalities there. Okay. So I'm going to take a couple of measurements and I'm going to do kind of the whole of your forehead, essentially looking for any signs of edema, which would indicate swelling. So this entire area is roughly 7 inches. We're about 2.5 below. Just going to measure. So there are not any external signs of swelling. I'm not seeing anything that would note edema. I really don't think this is an external problem. I'm going to take some temperature readings and see if maybe there's a difference in temperature in some of the areas that you were feeling it less than other areas. So you're just going to feel me place a thermometer on your skin. Let's start with the area that we would say you're feeling it the most. This is about 93. This area here. Actually warmer, so we're going up 96, 93, 96.4, 5, 6. Okay. On this side, 96.6. We do have some excess heat in these areas. Go ahead and check your scalp. About 94. I'm noting some slight increase in heat here. I have tool here that's going to allow me just to get a little bit of a better look. So I'm going to have a pretty up close look at your face. You might feel just kind of a plasticky tool on your forehead, okay? This is allowing me to get a more in-depth look at your skin. This is a pocket microscope, so it just magnifies areas for me so that I can better see the creases of your skin. Look at these areas that I noticed an abnormal texture. I do see some physiological abnormalities in these areas in comparison to the center of your forehead. And I do not see any of those same abnormalities anywhere else on your face. So that indicates that if this is a neurological disorder or something that's affecting your cranial nerves, it is isolated, which can help rule it out when we eventually come to a diagnosis. Let me have a look at your scalp. For anything normal. These are called manual auscultations, which just means I'm listening for anything that may sound different, such as a hollow sound. Or not hearing anything. Does this feel okay here? Any pain or discomfort in this area?
No, it feels fine.
And can you tell me if this feels the same as this?
Yes, it does.
And does this feel the same as this?
Yes, it does.
And this and this?
Yes.
It feels the same everywhere else, correct?
Correct.
Okay. You can feel this.
Yes.
This is cold.
Yes, it is.
Cold here.
Yes.
Same cold here. Here.
Colder the second one.
Colder here.
Yeah.
And here and here.
Colder the first one.
This is colder than this.
Yes.
Interesting. Okay. And this compared to this.
About the same. Maybe the first one is colder.
Can you tell me if this feels the same as this?
Yes. Yes. Yes.
There's no difference here?
No, it's not.
No difference here?
No difference.
Are either one of these colder than the other?
No. No.
Okay. Now, how about this and this?
Yes.
Yes, the same?
Colder on the second one.
This one's colder.
Yes.
Okay. And 1 or 2.
2 is colder.
2 or 2.
2 is colder.
How about 1 or 2?
2 is colder.
2 or 1.
2 is colder.
Very good. And can you feel cold here as well?
Yes. Yes.
Now here and here, is that the same?
Yes, it is.
Here and here.
One might be slightly, sorry, 2 might be slightly colder.
2 is slightly colder.
Yes.
So if we do here and here,
Yeah, 2 is colder.
2 is colder. Okay. So this is the same,
Yes.
but this is colder.
Yes.
So that's consistent with our other findings. It is still an abnormality, but at least we're not finding too much of a sway between sharp or cold. It's just kind of abnormal altogether, which is good. Okay. So I'm going to go ahead and listen to your scalp and forehead with my stethoscope. Okay. So far, I'm not hearing any abnormalities. It sounds equal. I'm hearing bilateral blood flow on both sides. Not hearing any overactivity in the areas that you feel more sensation. And I just gently place this over your eyes. There is no suspected lack of blood flow. Your auscultations sound completely normal and equal to each other. Okay. So I'm gonna have a look. Just another tool here. This might feel a bit odd. I want you to tell me if this feels any different than this.
No, it doesn't.
This feels the same as this.
The second one might feel a little sharper.
Okay. No difference here and here.
No.
Here and here.
No.
Here and here.
No.
Here, here, here feels the same.
Feels the same.
It feels the same all here as it does here.
I think so, yes.
Okay. Here.
Yes.
Okay. So no difference feeling sensation. So I think I want to try a different tool here. I have some cupping tools that I sometimes use for my acupressure patients. So I want to see if there's any difference in the oxygenation of your skin. So you're going to feel a slight suction.
Okay.
Okay, so there's a slight difference between two sides. This side appears to be slightly more oxygenated compared to this side. And then we have significant oxidation here in the middle. We can see that there is definitely no lack of flow to the center of the forehead. Okay. These tools will leave very superficial marks on your forehead, but they will go away in just a few minutes. I'm going to try something a little different. This will cover a bigger area. Okay, so getting decent results from one on this one. Still less on this side. Okay. It's a little better. Okay. Did get better results on this side though. Okay. So I'm beginning to think that this is more an issue of oxygen flow under the skin. So I do think we should recommend you do some cupping therapy and acupressure. So these are holistic therapies. I know some people kind of frown upon Eastern medicine, but it's not always a pill for me to give you. I'm not really sensing that this is any sort of serious neurological dysfunction. I don't think that there is kind of an issue with your cranial nerves, because you don't have any sensation in the rest of your face. You also don't have much sensation loss in your scalp. So I'm thinking this is more of an oxygenation issue, like I said. So I do recommend you have some cupping therapy done, as well as maybe some acupuncture. And that's where they put the small needles into different areas of your face. Okay, I think you might get some results with that. If nothing else, this might be kind of an edematous nerve, which basically means one of your cranial nerves has pressure being put on it, and that's why you're not feeling as much in these areas as you should be, and you would feel those effects more so when you're tired, and that makes sense given that you said you feel this more so late at night.
True. Yes.
So that's kind of what I'm leaning towards. Is this area here, I'm not getting any abnormalities with, so this appears to be very healthy in comparison to that side. Even when I use, it's slightly better. Okay. So I'll just take a note there. I'm going to recommend some moderate acupuncture as well as cupping therapy, specifically in the temporal region and possibly on the hairline, just to ensure that it doesn't spread anywhere else. And I can recommend you a couple holistic facilities that provide these options if you're interested.
Okay, thank you.
So I have some pamphlets with information that I will give you, and they have locations listed on the back that you can call to schedule an appointment. Giving you a very brief treatment while you're already here. Maybe this will kind of temporarily alleviate some of your symptoms, but you will need to go and see a specialist to get long-term benefits. Definitely this area needs some therapies. Okay. All right, James. Well, I think that will be all for our visit today. I believe we kind of come to the bottom of what your symptoms are related to.
Okay.
So like I said, I will hand those referrals off to the receptionist and you can pick those up on your way out. She should have a couple pamphlets to give you also with just some educational information about today's visit.
Okay.
And then highly recommend following up on that. Okay. So let's get some of these therapies in place. I would say, you know, talk to the specialist. I will coordinate with them, but maybe 1 to 2 sessions a week for at least 2 weeks. So that would be a total of 4 sessions. After that, you can kind of speak with them and I will speak with them as well. And we'll kind of see if you're having any of that sensation kind of come back in these areas. If you feel like, you know, you still need a little bit more, then I would maybe do another 2 weeks and then I'll have you come back in here for a second evaluation and we'll see if you've made any progress. And then if not, we can look into maybe something a little more aggressive, okay?
All right, sounds good.
All right, James. Well, thank you so much for coming in. And of course, if you start to experience any kind of total loss in sensation or any more of that tingling or any burning and it's spreading to different areas, I do want you to come back in because then we might need to have you sent off to a neurologist, okay?
Okay.
Okay, well, thank you so much. I hope you get to feeling better and I will see you in a few weeks.
All right, thank you so much.
Thank you.